If I told you your pillow and the way your head settles on it could nudge your brain's blood flow in the wrong direction while you sleep, would you change anything tonight? Most of us don't think twice about posture once the lights are off. But sleep isn't a passive state. Your neck angle, jaw position, and chest expansion all shift the way oxygen travels and how blood moves through the arteries that feed your brain. For people over 50, especially with hypertension, diabetes, atrial fibrillation, or sleep apnea, those tiny changes can add up over hours. Today, I'm going to walk you through the 5 sleep postures I see most often associated with airway collapse, neck vessel strain, and overnight blood pressure surges, and I'll show you a simple protective position that supports your spine, breathing, and circulation. I'll explain why each posture matters, what's going on inside your body, and low-cost tweaks you can try tonight. Keep listening for the position I recommend to my own patients and for the small adjustments that make it sustainable. If you've ever wondered why you wake up with a foggy head or a pounding pulse, you may find your answer hiding in plain sight, on your pillow. Let's start with what looks innocent. Flat on your back, arms and legs splayed comfortably. Many call it the starfish. On paper, a straight spine sounds good. In reality, gravity encourages the tongue and soft palate to drift backward. As we age, throat muscles lose tone, fat pads near the airway can enlarge, and nasal resistance tends to increase. The combination can narrow the airway and drop oxygen levels, especially if snoring or undiagnosed sleep apnea is in the mix. Lower oxygen nudges the body to stress mode. Your brain signals the heart to beat harder, vessels to constrict, and blood pressure to rise. Add a stiff neck pillow, and your chin tips up or down just enough to worsen things. If this sounds familiar, dry mouth, morning headaches, daytime sleepiness, try a gentle experiment. Use a pillow that keeps your head neutral, not poking up or tipped back. A soft reminder, like a small pillow tucked beside your back, can discourage nighttime rolling into a full supine sprawl. And if your bed allows a slight head-of-bed incline, some people find that reduces snoring without kinking the neck. Next up is the tidy back sleeper with arms down, what many call the soldier. It's neat and symmetrical, which is appealing. The catch is what your neck is doing. If your pillow is too low and your skull settles straight onto the mattress, or too high so your chin tucks, you can narrow the space where the vertebral arteries travel through the cervical spine. Those arteries help supply the back of the brain, including balance centers. People who wake dizzy, foggy, or with a stiff neck sometimes discover that a small change in neck position makes a world of difference. A cervical support pillow, a pillow shaped to fill the curve of your neck while keeping the chin neutral, can help keep those channels open and reduce muscle guarding. If you love back sleeping, place a pillow under the knees to ease the lumbar curve and make it easier to stay aligned. If you're managing blood pressure or cholesterol, think of sleep as part of your vascular routine, along with movement and nutrition. The goal isn't fear, it's fit. We're fitting the position to the body you have today, not the one you had at 30. The posture that raises the most red flags in my clinic is stomach sleeping with the head cranked to one side, often called free fall. Try it now for 20 seconds. Turn your head all the way to the right and hold. You'll feel the pull down one side of your neck and the compression on the other. Now imagine holding that angle for hours. That combination of twist and extension strains the joints and can compress or stretch the carotid and vertebral arteries. Over time, and especially with age-related changes in the neck, this can irritate the vessel lining, aggravate neck pain, and trigger nighttime awakenings. Stomach sleeping also puts pressure on the rib cage, which can limit deep breaths and keep oxygen just a little lower than your body likes. If you're a committed stomach sleeper, because back sleeping makes you snore, consider that the snoring may be the real issue, not the position you're choosing to avoid it. A gentle side sleep setup, contoured pillow under the head, small pillow in front of the chest to hug, and one between the knees, can satisfy the pressure on the front feeling many stomach sleepers crave while sparing the neck. It's about giving your body a new favorite that feels just as comforting. What about curling up on your side like a comma, the classic fetal posture? Side sleeping is often helpful for snoring and reflux, but when the curl gets tight, the benefits can slip away. Tuck your chin hard to your chest and pull your knees up to your ribcage, and you'll feel your breathing shorten and the back of your neck close down. Deep flexion can compress structures at the front and back of the neck at the same time, while your chest position limits full diaphragmatic breaths. For someone managing blood pressure or heart rhythm issues, repeated shallow breathing overnight can mean higher morning pressures and a more irritable cardiovascular system. The solution isn't to abandon side sleeping, it's to soften the curl. Aim for knees bent about hip width, not jammed up to the chest. Keep space between your chin and chest. Imagine an apple resting just under your chin to remind your neck to stay long. A pillow between the knees keeps the pelvis neutral, and a supportive head pillow fills the gap between shoulder and ear so your head doesn't sag or tilt. There's one posture that sneaks up on people. The twist, hips pointed one way, torso rolled the other, neck turned in a third direction. I call it the pretzel. You might drift into it chasing comfort, especially on a soft mattress that lets the shoulders sink while the hips stay high. The problem is cumulative torsion. The spine likes curves. It doesn't love long, sustained wringing. Twisting can tug on the vessels running alongside the spine and confuse the body's pressure sensors in the carotids that help steady your blood pressure at night. Some people wearing overnight monitors show clear pressure swings tied to these twisting moments. If you've ever woken with a racing heart and no dream to blame, this may be part of the picture. Preventing the pretzel is surprisingly simple. A long body pillow along your front keeps the chest from rolling forward, while the pillow between your knees keeps the hips stacked. If your mattress is very soft, consider a medium firm topper that stops you from sinking unevenly. These are small mechanical tweaks with outsized effects on how your brain and heart rest. Let's connect the dots on why alignment matters so much after 50. As we age, arteries can stiffen, the lining can become more fragile, and plaques can appear where blood flow churns or rubs. At the same time, muscle tone fades, including in the tongue and throat, making airway collapse more common, particularly in REM sleep when muscles are most relaxed. Add changes in the spine from arthritis or disc wear, and the neck may have less room to forgive extreme angles. None of this is a reason for alarm. It's a call to be clever. Gentle alignment keeps vessels unkinked, airways open, and your body's built-in pressure sensors happy. If you have known risk factors, high blood pressure, diabetes, atrial fibrillation, a prior TIA, or diagnosed sleep apnea, your nighttime posture is one of a handful of modifiable levers you can pull daily. We can't change our birthdays. We can change the way we stack our head, neck, and chest for 8 hours. People often ask, is there real evidence that position influences oxygen and nighttime pressure? We have strong evidence for positional sleep apnea. Many people snore more and have more breathing pauses on their back than on their side. Side sleeping often reduces snoring, improves oxygen, and lowers arousals. In neck mechanics research, we see that extreme flexion, extension, or rotation narrows bony canals and compressible spaces where vessels and nerves travel. Observational studies link fragmented sleep, untreated apnea, and nighttime blood pressure surges with increased cardiovascular risk over time. What we don't have, and I want to be clear, are perfect one-size-fits-all numbers that say, this posture equals that risk for every person. Bodies vary. That's why I focus on directionally sound changes that are low risk and high reward. Neutral neck, open airway, steady breathing, minimize twisting. The best data we have points to side sleeping with good support as the safest default for most older adults, particularly if snoring is present. And when you can't stay there all night, building guardrails helps. If this is clicking for you, here's where I'd start tonight. First, choose your target, a comfortable, aligned side sleep. Second, set the equipment. Your pillow height should roughly match the distance from the tip of your shoulder to the base of your neck, so your head doesn't droop or tilt. A medium-firm mattress or topper prevents your shoulder from collapsing and your spine from bending like a banana. Place a pillow between your knees to keep hips level. For those with broad shoulders, a contour pillow that supports the neck curve can be a game changer. Third, create bumpers. A long body pillow in front gives your top arm a place to rest and stops you from sliding into the pretzel. If you habitually roll to your back, a light pillow behind you can make that angle less likely. These small barriers are gentle nudges, not rigid cages. And finally, watch your nose. If nasal congestion forces you to mouth breathe, your tongue will fall back more easily. Saline rinses, humidification, and allergy management can make side sleeping more comfortable and effective. A quick reality check about habit change. Your body loves what it knows. If it knows stomach sleeping, the first few nights of side sleeping may feel strange. That's normal. Start by spending only the first hour in your target position. When you wake in the night, reset without self-criticism. The brain learns by repetition, not judgment. Within a couple of weeks, most people report fewer awakenings, easier mornings, and less neck stiffness. If you wear a smartwatch that tracks heart rate or overnight oxygen, you may notice steadier numbers when your position stays aligned. If you don't track anything, go by feel. Morning clarity, fewer headaches, and less throat dryness are meaningful signs. And remember, position is one piece of a bigger sleep health puzzle. Gentle daytime movement, steady blood pressure management, not smoking, and taking medications as prescribed are the pillars that make posture matter even more. Think of your aligned side sleep as the nightly maintenance that keeps your vascular plumbing running clear and calm. How do you tailor these ideas if you live with reflux, spinal stenosis, or shoulder pain? For reflux, a modest head-of-bed elevation, raising the head end by 4 to 6 inches using risers, can reduce nighttime acid without scrunching the neck with extra pillows. Pair that with left side sleeping, which for many helps the stomach sit below the esophagus. For spinal stenosis, some people prefer slightly flexed knees with a pillow, taking pressure off the low back while keeping the neck neutral. For shoulder pain, a pillow that supports the top arm so it doesn't drag the shoulder forward can be enough to make side sleeping comfortable. Some use a thin pillow under the bottom shoulder or a mattress topper to allow gentler sinking. If arthritis limits neck rotation, be especially cautious about stomach sleeping and deep twisting. And if you work with a physical therapist, show them your sleep setup. Small ergonomic tweaks based on your body's history can turn "I tolerate sleep" into "I recover during sleep." If this is helping, take a moment to subscribe to Senior Vitality Pro and tell me your age or where you are watching from in the comments. I read them and shape future topics around your needs. Your questions often become next week's deep dive. Let's revisit the 5 risky postures with quick fixes you can try tonight. For the starfish back sleeper, elevate your airway, not your chin. Choose a pillow that supports the neck's natural curve and consider a slight bed incline if snoring is an issue. For the soldier, focus on neck neutrality with a cervical support pillow and cushion under the knees to ease the lower back. For the free-fall stomach sleeper, mimic the pressure you like by hugging a body pillow while lying on your side. Place a pillow in front of your chest and one between the knees so your body feels held. For the tight fetal curve, soften the tuck. Keep space between chin and chest and keep knees comfortably bent, not jammed. For the pretzel, block the twist with a long body pillow, stack hips with a knee pillow, and consider a slightly firmer sleep surface. None of these fixes require fancy gear. They require intention and a few pillows used thoughtfully. Warning signs during the night deserve your attention. Loud habitual snoring, choking or gasping arousals, witnessed breathing pauses, morning headaches, or waking unrefreshed despite sufficient time in bed can all point to sleep apnea. Untreated sleep apnea raises blood pressure, strains the heart, and increases vascular risk over time. If you recognize these patterns, speak with your clinician about a sleep evaluation. Positional therapy helps many, but it's not a substitute for proper diagnosis and treatment. For some, a CPAP or an oral appliance plus side sleep positioning is the winning combination. If you have atrial fibrillation, keeping oxygen steady through the night and avoiding big swings in pressure is especially important. Positioning isn't a magic cure. It's a multiplier. It makes every other good habit you're already practicing work better by removing a nightly stressor you can't feel while you're asleep. Let's talk breathing. Deep, slow breathing is built on a relaxed jaw, a free tongue, and a nose that's doing its job. If you fall asleep clenched, your airway narrows before the night even begins. A simple pre-sleep ritual helps. A few minutes of gentle jaw stretches, a tongue posture check, resting lightly against the roof of the mouth, and a nasal rinse if you're stuffy. Some people find that a soft, flexible mouth tape keeps the lips closed and encourages nasal breathing, but only consider this if you can breathe comfortably through your nose and you do not have significant nasal obstruction. When in doubt, skip it and talk with a professional. Humid air, especially in winter, reduces dryness and discourages the mouth from popping open. Pair this with side sleeping and you'll likely snore less, oxygenate better, and keep your heart rate calmer overnight. Less noise in the bedroom usually means less noise in your cardiovascular system. We can't discuss neck angles without discussing pillows. A good pillow is not soft or hard, it's fitting. If your pillow is too tall on your side, your neck bends up. Too short, and it sags down. Either way strains muscles and can narrow spaces where vessels and nerves travel. Measure the distance from the outer edge of your shoulder to the base of your neck. That's your target height for side sleeping. Back sleepers usually need less height with a small roll under the neck, not a big mound under the head. Stomach sleeping is hard on the neck regardless, but if you cannot change it right now, use the thinnest pillow possible and place a small pillow under the pelvis to reduce lumbar extension. Replace pillows when they stop supporting you. If you wake with a better neck after naps in a chair than after a full night in bed, your pillow isn't doing its job. Your spine should feel long and neutral, your jaw easy, your breath quiet. Mattress talk gets emotional because it's a big purchase. The good news, you don't need perfect, you need supportive enough. 2 soft beds let the heavy parts sink, while the lighter parts twist to follow, setting up the pretzel. 2 firm beds create pressure points that push you to curl tightly. A medium firm surface tends to hold the line. Shoulders can settle without collapsing. Hips stay level. Knees don't knock. If replacing a mattress isn't in the cards, use a medium firm topper and then fine-tune with pillows. Side sleepers sometimes benefit from a small towel roll under the waist if there's a gap between rib cage and pelvis. Back sleepers feel better with that pillow under the knees. Test changes for a week. Your body needs time to adapt. Your morning body is the judge. Are you less stiff, clearer in the head, calmer in the pulse? That's your yes. Hydration, evening habits, and medications intertwine with posture. Large, late meals push reflux and can make back sleeping much noisier. Alcohol relaxes throat muscles and deepens snoring, especially on the back. Late-night decongestants can dry the nose, leading to mouth breathing and airway collapse. On the flip side, gentle evening walks, earlier dinners, and consistent blood pressure medication timing support a steadier night. If you're on medications that influence dizziness or blood pressure, rising carefully in the morning matters. Sit, breathe, stand. And if you monitor blood pressure at home, try a simple experiment. Record your evening and morning readings during a week of mismatched sleep and a week of aligned side sleeping. Many people are surprised by how much calmer their mornings become when their neck, airway, and chest were well supported through the night. Now, the position I recommend most often, and the one I use myself, aligned side sleeping. Picture a straight line from the crown of your head through your neck, spine, and tailbone. Your head is supported so it neither tilts toward the mattress nor tips toward the ceiling. Your shoulders stack, not rolling forward. A pillow between the knees keeps the hips aligned. A body pillow in front supports the top arm and prevents your chest from twisting. Your jaw is relaxed, your tongue resting up, your nose free. Breaths are quiet and deep, and your heart rate drifts down. This position tends to reduce snoring, steady oxygen levels, and minimize unpredictable pressure swings. If you live with reflux, favor the left side and consider a gentle head-of-bed elevation. If pain or anatomy make pure side sleeping difficult, aim for a side-ish posture with the back supported by a pillow to keep you from rolling flat. It doesn't have to be perfect to be powerful. Make the switch step by step. Night 1. Set up your pillows and practice the aligned side posture for 5 minutes while awake. Feel your breath in the lower ribs. Night 2 and 3. Fall asleep in that position. Nights 4 to 7. When you wake in the night, calmly reset. Head neutral, shoulders stacked, knees cushioned, body pillow hugged. Week 2. Review what's working. Is the head pillow the right height? Are your shoulders sore? Adjust the pillow thickness or shift the body pillow slightly under your chest to share the load. Week 3. Consider a mild bed incline if snoring or reflux is still present, and troubleshoot nasal comfort. This is a gentle training program, not a boot camp. Your nervous system loves predictability. Give it the same starting posture nightly, and it will start choosing it spontaneously. A word on safety and when to seek help. If you ever experience sudden weakness or numbness on one side, face drooping, slurred speech, vision loss, a thunderclap headache, or severe imbalance, call emergency services immediately. Don't wait for morning. Those are classic signs of stroke, and minutes matter. If your bed partner notices pauses in your breathing, if you wake gasping, or if your morning blood pressure is consistently higher than evening readings, speak with your clinician about sleep apnea assessment and blood pressure management. Positional strategies are safe for most, but they're not a replacement for medical evaluation when warning signs are present. Bring a photo of your sleep setup to your appointment. It's a great conversation starter and helps your clinician offer specific advice tailored to your body and conditions. One of my favorite parts of this work is watching small, practical changes ripple outward. The woman who thought she needed a new medication, but instead needed a new pillow. The gentleman who couldn't shake morning brain fog until he gave up the pretzel and found a body pillow he loved. The caregiver who elevated the head of her husband's bed, switched him to left side sleeping, and noticed fewer nighttime coughing spells and steadier morning numbers. These are not heroic interventions. They're everyday mechanics done thoughtfully. If you've ever upgraded the lighting in your kitchen so you could see your cutting board without squinting, you already understand the concept. We are lighting the path your blood and air take at night. We are removing shadows in the airway, easing curves in the neck, and giving your body calm conditions to heal. You might be wondering, do you have to sleep perfectly aligned every minute to see benefits? No. Sleep is dynamic. We roll, we adjust, we chase cool spots. The goal is to spend more of the night in the supportive zone and less in the extremes. Not jammed into a tight curl, not flat on your back with your jaw sagging open, not twisted like a rope, not face down with your neck torqued. Think of it as a thermostat, not a switch. Nudge toward the range where your airway stays open and your vessels stay unkinked most of the time. Over weeks and months, that nudging adds up to calmer nights and kinder mornings. And when life gets messy, a cold, travel, a new mattress, fall back on your basics. Neutral neck, open nose, stacked shoulders, supported hips. As we close, let's anchor the takeaways you can act on tonight. Choose a side. Support the gap between shoulder and neck with a pillow that fits you. Keep your chin off your chest and your head from tilting back. Cushion between the knees to stack the hips. Prevent twisting with a body pillow. If snoring or reflux is part of your life, consider left side sleeping and a small head of bed elevation. If back sleeping is unavoidable, use a neck supporting pillow and a knee pillow, and keep the jaw relaxed. Avoid long bouts of stomach sleeping if you can. If you can't, keep the pillow thin and work toward a side setup that feels just as comforting. And if warning signs are present, snoring with pauses, morning headaches, big blood pressure swings, bring them to your clinician. You have more influence over your night than you think. Thank you for caring for your brain in this very practical way. Sleep is where your body does its deepest repair work, and posture is the scaffolding that makes that work easier. I'm cheering for your first aligned night. In the comments, tell me what position you've used for years and what change you're willing to try. I read every story, and your experience helps others feel less alone as they experiment. Share this with someone who still falls asleep twisted or face down and wonders why morning feels so rough. Tiny changes, night after night. That's how we protect the brain we love. Sleep well tonight.